This documented case will cover a chrome maxillary FP3 surgery using traditional guided smile protocols. The records for this case are photos per the checklist, master impressions or digital impressions with all land areas of the surgical arch, and then a CBCT scan with the teeth apart. We provide some very comprehensive, helpful checklists for the team to gather records. They are located on the GuidedSMILE.com website, and you just simply print them off and just have the team check off each one of these items. You can see here we have images of what the photograph should be: full face, full smile, exaggerated smile, profile, left, right, center, retracted in occlusion, so we can see how the teeth are coming together, master caster impressions, bite registrations, and of course this can be digital, and then a CT scan with the teeth apart. All right, so those are the records. Once we receive the records, we will quickly analyze the case, articulate, follow your instructions, or contact you about opening the bite. And then if everything looks good, we should be able to have a meeting within 4 or 5 days with you to plan the case. And then we will complete the case and ship it to the laboratory to return to you. So on the day of surgery, the first step is to try in the pin guide. And the pin guide is the plastic delivery device that connects to the fixation base, which is the metal foundation guide here. Connect them together, make sure it fully seats so that you can see in the windows here that the pin guide is seated against the teeth perfectly. Then you will remove both and you'll lay a labial flap. This is what it'll look like after it's installed. But you'll lay a labial flap and then return the pin guide and fixation base to the mouth. And the team will hold the pin guide firmly against the teeth with their fingers, not with the opposing teeth, but with their fingers. Hold it firmly through the entire pinning process. Now you'll notice here that 1, 2, 3 are green and 1 is white. And what that means is that the white is a long drill and pin, and the green are short pins and drills, and they come in a special fixation kit that is just made for GuidedSMILE only. And on our surgery mat, which you'll have on the wall, it'll say here, long pin is C, and the short pins are A, B, and D. And you'll see that reinforced here, and it'll be reinforced here as well. And here you have cross sections of where the pins are, so you can see if there's any vital anatomy. That'll be any type of issue. Once the pins are set, then you'll use a surgical mallet to tap them all the way down to the metal. Now in the maxilla, you may want to stop 1 millimeter or 2 short, and then use a surgical mallet to tap them to full depth. All the while, the team is holding down the pin guide against the teeth until you're completely done with the pinning process. Once the pins are fully seated, then you will remove the pin guide. You'll perform tooth extractions, and then you will adjust the bone down flat until it meets the coronal part of the fixation base. This is the bone reduction level. Now, one thing to notice here is that the surgical guide is floating. It never touches the bone. And you'll notice on the surgery mat that this is easily confirmed with this view. You can see here how the bone and the metal relationship is, and so you could take a quick visual look to make sure that the fixation base is in the proper space, in the proper position. Once you're finished reducing bone, then seat the carrier guide. The carrier guide is a confirmation that the bone has been reduced adequately down to make sure that the prosthesis is going to sit and that you have room for tissue. If for some reason the carrier guide is not seating fully, then remove it, adjust more bone, and then reinsert until it fully seats. And just be cautious that it's not the tissue underneath that's holding it up. because if this is rocking, it might be rocking or teetering on the tissue and not the bone. But after a little discovery, you'll find whether it's tissue or bone holding it up. So reduce the bone or tie a stitch or remove or hold the tissue back. And once you're positively seated, then this is removed. And then you'll insert the osteotomy guide. Now with Chrome GuidedSMILE, you'll notice that there are nubs and that there are just cylinders for sleeves. And the reason is because the nubs are for indexing. These are for angled sites, and this is for a straight site. And on the surgery mat, we have indications here for which tool to use in the kit, where the position is of the implant, the size of the implant, and then the platform of the implant. So this is a very handy at-a-glance surgery mat taped to the wall, and you just simply can look up from many feet away and have this as a guide, as a tool to get you through the surgery. So jumping a little bit ahead here, all the implants are in, and notice that the doctor uses an interesting tactic here of leaving mounts inside the surgical guide to stabilize the osteotomy guide. And with Nobel, if you're using the active kit, you'll notice that the driver or the mount is not intimate with the sleeve and that there is a gap. And so you'll want to be very careful to keep the driver in the middle of the sleeve and try not to let it deviate over to touch a side of the sleeve, because that will have some ramifications of where the exit screw is on the prosthesis. It'll also affect where the temp cylinders are in the holes. So that's with active. Now, I've seen where doctors buy a Nobel parallel mount that works with active, and it is much more intimate with the sleeve, which is a very nice option to have full guidance. But that's up to the operator, which tool they'd like to use. Once all the implants are in, then the abutments are seated. Now you'll notice right here, and on all cases where there's angles, there's a little notch. And the notch indicates where the driver or the abutment screw trajectory is. So that way it'll help you with seating the abutment. You'll see here's a screw access and here's a notch. Back here's a screw access and then there's the notch, etc. Again here. So that will help you orient your abutments into the implants. Once the abutments are in, place the temp cylinders, and then the next step is to use the gaskets to wrap the temp cylinders, and then you'll seat the prosthesis, and then you'll just simply backfill and lute the prosthesis to the temp cylinders. And here it is all assembled with the gaskets and the blockout plugs, and then Stellar. Stellar's optional, but we love it because it's a dual cure and it lasts through the healing process. You can hit it with a light for about 20 seconds and it's a full cure. Just a wonderful, easy to use material. And so you'll perform this pickup on both the wear home prosthesis and on the rapid appliance, which is the second pickup. And the second pickup and the surgical prosthesis were what the restoring doctor used in coordination to go to final restoration. The patient never has to give up their appliance. And you can actually send this prosthesis to the lab with a bite and an opposing and a wash, and you could even go right to final while the other prosthesis goes home in the patient's mouth on that restorative visit. So the prosthesis comes out, obviously what's going on here, and then delivered, right? So either the staff or the laboratory, really the part from here to here, sure, a dental lab tech is handy to have, but really auxiliary staff should be able to finish these restorations, keeping the costs low and giving the team a skill to do. So that is a maxillary FP3 chrome GuidedSMILE standard protocol.